1 in 3 women experience a pelvic floor disorder at some point in their lifetime, and this risk increases with pregnancy, birth, menopause, weight gain. So more women experience urinary leakage than heart disease or osteoporosis, yet most don't even understand that pelvic floor is the source of their problem.
And so a lot of women, unfortunately, suffer in silence. Lucky for us, today we have an expert joining us to talk all things pelvic floor. You may recognize her from her countless appearances, whether it be on Today or her TED Talk. She also has a massive following on TikTok. Please welcome pelvic floor therapist, Dr. Sara Reardon, also known as the Vagina Whisperer.
I love that.
And I love that, and we need to destigmatize it. So first and foremost, why do you think that we have such like a stigma surrounding all of that?
You know, a lot of pelvic floor disorders are really embarrassing, intimate issues that we don't often talk about publicly, but we don't even know who to speak to about it. Do we talk to a gynecologist, our primary care doctor? So it's really important for medical providers to ask these questions so that patients can offer the information if they are experiencing a pelvic floor problem.
Let's kind of start with the basics. Can you explain just what a pelvic floor is? I feel like we hear the term, but what exactly does that mean?
So I'm a pelvic floor physical therapist, and physical therapists work with muscles and tissues and nerves in the body, and I work with the pelvic region of muscles and tissues and nerves. The muscles sit like a basket at the bottom of your pelvis, and they support your uterus, your bladder, your reproductive organs, and they help with bowel movements and urination. So we're using them all throughout the day, and we just don't realize it until we start experiencing a problem.
Ooh, so let's talk about some of those pelvic floor problems. What are the most common, and what can women do to treat those problems?
So I would say the most common, hands down, is urinary leakage. We think this is a bladder issue, but it's actually a muscle issue because we can't hold that muscle tight enough to keep the urine in. And then also other issues like pelvic organ prolapse, painful intercourse, even challenges with bowel movements, anything that has to do with this region of the body. And what we need to do is, one, pelvic floor physical therapy is an excellent source of treatment for women. These issues are common but very treatable. So seeing a pelvic floor therapist, a lot of the resources I talk about in my book, Floored, are available to really help women better understand their bodies.
Hey, this happens to me.
I
mean, I think, you know, after having 2 kids, everything you just said, I have experienced. So I'm glad that we're talking about it.
And I'm curious, because all I know, if I'm being honest, is, you know, what I see on TikTok. I'll stop and I'll do the little squeeze and release. Since we, you know, I'm like, oh, this is good. I'm going to do this today. And then I never think about it again.
Right.
But from the expert, what are some tips and things that we should be doing to make sure we're taking care of our pelvic floor?
So the first thing is, we often think of pelvic floor exercises as Kegels, which are a strengthening exercise. But many women actually have pelvic floor tension, and Kegels could make their problem worse.
Oh.
Right. And so you want to think about, in that situation, you need relaxation, stretching, massage. So the first thing is to determine whether you have tension and need relaxation, or have weakness and need strengthening, which would include Kegel exercises. Other simple things are not pushing when you go to the bathroom for bowel movements or urination, exhaling when you're lifting something heavy or lifting weights, kind of paying attention to your posture, and just some daily tips that we can use to prevent pelvic floor issues, but then get treatment right away if they occur.
So you mentioned something that one of your videos went viral. First of all, if you're not following the Vagina Whisperer on TikTok, and I want to know how you got that moniker, by the way. But one of those videos that went viral was the one where you're not supposed to push when you urinate. I did not know that.
Yeah.
I feel like that's how you get the rest out.
Yeah.
You got a little push there at the end.
I know.
You're not alone. Most people don't know this because we're never taught it. We don't get pelvic floor education like we do maybe period education or sexual ed. So these simple tips, like not pushing when you pee, are really important, and they could cause pelvic floor issues if you continue to do them. So instead, sit down, don't hover, take some big deep breaths, and let your bladder push the urine out for you instead of pushing even those last few drops.
Okay. That's such good advice, because it's something I don't think about. I'm like, this is fine. But you are here in Denver because you're talking about your new book, Floored, a complete guide to women's pelvic floor health at every age and stage. I want to read this. I also love the cover. What do you hope people get out of your book when they read it?
You know, this book is really for women of every age and stage, whether you have older parents that you're taking care of yourself or even raising young women. And so I think I want women to understand that this muscle exists, how it works, what's normal, what's not, and some tips and strategies you can use at home if you do have pelvic floor problems, instead of suffering silently because they don't get better on their own. It's also a really great book for medical professionals. I think a lot of medical providers don't know what pelvic floor therapy is or how to even screen for an issue, so it's really important we get those docs on board as well.
That's so true, because it gets dismissed and
Right.
then you suffer in silence. So before we let you go, how did you get that moniker?
So it actually is a nickname for my group of girlfriends from college. I started as a pelvic floor therapist 18 years ago, and one summer we went on a trip and I ended up talking to their moms about all their bladder problems, and they said, oh my gosh, Sarah's like the vagina whisperer. And so I started my Instagram account in 2017, and it was for my group of girlfriends, and since then it's really taken off.
Oh
That
my
is
goodness,
awesome.
as it should. Thank you, thank you, thank you. And to all of the viewers out there, you can meet Dr. Sara Reardon at the reading of her new book, Floored. You'll also be signing copies, which is exciting. That is tomorrow evening, Friday, June 27th at 4:30 at the Denver Village. Tickets are on sale right now on Eventbrite. Thank you so much, Dr. Sara. So great to meet you.
Thanks
Thank
for
you.
having me.
That was in